Welcome to Beaches Health Group. I'm Dr. Kelly Robazza. I'd like to talk about chiropractic care today and a normal process in our office after we do a full examination of the patient and history is to do what we call a report of findings. And that's where I take the patients into the office here and explain exactly what they brought in. Is it appropriate that we treat it with chiropractic care? How often? Why? How long? And so on. So we go through all the nuts and bolts of that in the report of findings, but I just want to take some time and give you my little Reader's Digest version of what a report of findings is. Oftentimes what we look for initially is alignment initially in an exam. So the spinal alignment should be nice and straight back to front. And we use the landmarks like the hips, the ribs, the shoulders, the head levels to see if there's postural alterations. Okay? From the side view, there actually are normal curves in the spine. A C curve in the neck inward called the lordosis, a C curve outward in the mid-back or the thoracic kyphosis, and back into the lumbar area, an inward curve called the lumbar lordosis. Once we establish the alignment and if there is any needs for alignmental change, what we want to look at is the function of the segments of the vertebrae. What we want to have is every vertebrae equally sharing the load during a range of motion. Oftentimes when people present with what we call subluxations or stuck vertebrae, they could be stuck because they're misaligned or they could be held by a group of tense muscle, but oftentimes the person still achieves a full range of motion, but it's not a pretty sight and wrought with lots of mechanical difficulties. How we can avoid spinal degenerative changes, and we'll go through that in a second, is by trying to achieve this normal function throughout the whole spine. By having this vertebral position and function, it does also prevent nerve irritation and stops a lot of the nerve pressure symptoms that we see, headaches, pains, numbness, tingling, that kind of thing. If you're allowed to function with poor spinal mechanics, your vertebrae are going to get excessive wear and tear, and that's called osteoarthritis. And this just shows the advances of arthritis. And all of us are going to wear out in our lifetime. We just don't want one segment or group of segments to have accelerated wear and tear. If that can be achieved, we can really prevent long-standing arthritic changes in people, not only get them out of pain, but also save their spinal health for their entire life. I just want to mention a little bit about the low back, lumbar spine. It's what chiropractic is best known for, and this is the reason why. The functionality of the spine is individual segments until it gets to the sacral area, which kind of blocks off the whole pelvis and it creates immobility. The sacroiliac joints, or the sacrum and iliac, form a joint which really transfers our weight bearing into motion. I'll bet you 2/3 of the people that I see with low back pain have locked up or dysfunctional sacroiliac joints. Puts an additional ton of stress on the low back. And if those sacroiliac joints aren't moving properly, you're going to create a lot of additional stress put on the lumbar disc, which adds to whole other kettle of fish and brought with symptomatic problems with disc degenerative changes and sciatic pain. So the X-ray is the final piece to the puzzle. We've now completed a report of findings where we've taken the patient's complaints and considerations, found out the reasons for those, and explained a treatment plan of action to get them back into functional state again. So we've completed the report of findings, and now it's time to get down to business. And basically, I want to just show you what a normal chiropractic visit looks like. We usually have the patient lying face down, and really we're palpating to find out where those subluxated or those dysfunctional vertebral sections are. And basically, we get the patient to take a breath and let it out. So it's quite gentle. You hear lots of stories about what chiropractic adjustments feel and look like, and they're not ninja moves. They're very specific, dedicated movements toward a correction of the spinal area. We would direct those at any place that had dysfunction. from the neck to the mid-back, lower back, and sacroiliac joints. Some of the symptoms that we treat with chiropractic care basically involve anywhere from the head down to the lower body. So if it's a pinched nerve in the neck, it'll be a headache symptom or visual disturbance, possibly a referred pain into the upper arm. Mid-back complaints, ribs, shortness of breath, muscle spasms. Low back conditions, very commonly and frequently and successfully treated with chiropractic care. These are some of the things that we use chiropractic care for at Beaches Health Group, and hopefully you understand a bit more about why we use chiropractic care.